Welcome. My name is Ellen Vera, and I'm with our Provider Outreach and Education Department. This video will discuss the physician impact when a patient's status changes from inpatient to outpatient. A change from inpatient to outpatient will impact the physician's billing to Medicare. Here is the information we want you to have at the end of this presentation: why and how a patient's inpatient status may change, understand the physician's role in the change, and then finally understand the necessary physician's actions. Hospitals either have on staff or contract with organizations to perform utilization review. This is a committee that assists the hospital in determining whether the inpatient stay is medically necessary. The committee can look at the admission, the length of stay, and any services or procedures provided during that stay. The committee can make this evaluation about the stay either before, during, or after the stay. The Utilization Review Committee will utilize physician documentation, including medical records and certifications for that hospital stay. The Utilization Review Committee should be in contact with that admitting physician. This contact could include requests for documentations and certifications. It can also include requesting the admitting physician to support why they believe the patient needs the inpatient level of care. And finally, the Utilization Review Committee should provide that decision. If the Utilization Review Committee decides the inpatient stay is not medically necessary, the committee will communicate that to the admitting physician. The physician should then share that information with the patient and any other physicians or non-physician practitioners providing services to that patient. The hospital has the responsibility of formally informing the patient. Services provided prior to that patient's status changing are payable services, but they are not observation care. Observation care for the physician and hospital does not start until the physician or non-physician practitioner orders the care. Observation care could be ordered following notification that the UR Committee or Utilization Review Committee is not approving the inpatient status of the patient. The physician could submit charges for observation care following that order. Providers cannot backdate that order. You can find more information in the Internet-only manual, Publication 100-04, Medicare Claims Processing, Chapter 12, Section 30.6.8. The URL for that manual is in the description of this video. Medicare can allow the services provided to the patient prior to that change in patient status. These services, however, cannot be billed as an inpatient service. The services are now outpatient services. This means that any evaluation and management services provided would change from an inpatient category to the office or other outpatient care category. Documentation would need to support the level of care chosen. A change in patient status also changes the patient liability for the professional services provided. Generally, inpatient evaluation and management services allow higher amounts than the office or other outpatient services. Because of this, providers will need to either change their billing prior to submitting the claim to Medicare or change that billing if already processed by Medicare. In addition to the patient liability issue, Medicare requires the Medicare files to match so that claims processed for the facilities and under Medicare Part B for the professionals should paint the same picture. If Medicare has already paid for the inpatient service, then providers can use either the overpayment claim adjustment or the clerical error reopening process to correct the claim, to change this to the appropriate evaluation and management services. These functions are available in our transactional portal. The manual for the portal is at the bottom of each of our web pages in the blue box. This manual provides screenshots and also detailed instructions. Another item to consider is that if the patient is not an inpatient based on the Utilization Review Committee decision, then the 3-day, 1-day payment window and the rules and regulations for that do not apply. The provider may be able to submit charges directly to Medicare rather than to the facility. If you found this video and information helpful, please like and share it. If you have not already subscribed to our YouTube channel, we encourage you to do that. Thank you for taking the time to view this video.